Hello everyone and welcome back to class. This is Applied Anatomy and Physiology, AAP 301 for the College of Natural Health Sciences, Bermuda. My name is Dr. Delcina Bean Burrows and this is lecture number 3, where in today's lecture we will be looking at common pathologies. Now, in terms of our lecture 23 objectives, at the end of today's lecture, students will become familiar with the following common pathologies in humans: atherosclerosis, coronary artery disease, asthma, tuberculosis, lung cancer, kidney stones, gastroesophageal reflux disease, also referred to as GERD, liver cirrhosis, gallstones, osteoporosis, sciatica, and carpal tunnel syndrome. Now, in terms of common pathologies in humans, the human body has multiple systems that work together to maintain normal function. But what happens when processes fail? In today's lecture, we are going to look at some common human pathologies. Now, the first common pathology that we're going to consider today is atherosclerosis. In terms of the normal physiology of the arteries, arteries carry blood away from the heart to tissues throughout the body, supplying them with oxygen and nutrients. But in the case of atherosclerosis, the pathology occurs when plaque forms beneath the endothelium, which is the innermost layer of the artery wall. These plaques are where cholesterol accumulates, causing inflammation and restricting the flow of blood in the arteries. The decrease in blood flow can lead to myocardial ischemia, a disease in oxygen supply to heart muscle tissue. The chances of developing atherosclerosis rise with obesity, high cholesterol, and advanced age. So we can see here the normal artery, what it looks like, but with the atherosclerosis artery, the first visible sign is the fatty streak formed when excess cholesterol in the blood invades the endothelium, causing accumulation and inflammation. The next common pathology that we're going to consider is coronary artery disease. This is when plaque ruptures and heals and a thrombus can form, which increases ischemia. As more plaque accumulates in the coronary artery, it becomes harder and more narrow, resulting in less blood flow and oxygen to the heart. This is called coronary artery disease, or CAD. CAD is the most common type of heart disease and is the leading cause of death in the United States in both men and women. CAD can lead to angina, which is chest pain, or even a heart attack. Over time, CAD can also weaken the heart muscle and contribute to heart failure, where the heart cannot pump blood adequately, and arrhythmias, which is abnormal heartbeat. Next, let's consider asthma. The physiology of airway defense is such that receptors in the airways react to particles and toxins, which are irritants, by triggering short-term bronchospasms, sudden narrowing of the bronchi, or bronchoconstriction, which is contracting or tightening of the smooth muscle in the airways. This allows foreign particles to be expelled quickly. The airways epithelia are lined with cilia and mucus secreting cells. The mucus traps inhaled debris and cilia sweep it up into the pharynx to be coughed out or swallowed. This is vital to the protection of the lungs and alveoli and to the restoration of normal airflow. However, in the case of pathology, asthma is characterized by an overreaction of the airway's defenses. Currently, more than 25 million people in America have asthma. It can be triggered by inhalation of certain particles like dust and/or allergens. During an attack, excess mucus production caused by irritation can lead to the bronchoconstriction and edema, which is fluid trapped in the body's tissues that causes swelling, which makes pulmonary ventilation or breathing very difficult. The next common pathology that we're going to consider is tuberculosis. The physiology of lungs. The lungs have spongy, light, and elastic texture that allows them to expand and contract during breathing. Air fills the lungs as we breathe. Oxygen is then transported from the lungs into the bloodstream and then to the body's cells. As cells take in oxygen, they exchange it for carbon dioxide, a waste gas. The carbon dioxide is then transported back to the lungs through the bloodstream and breathed out. In terms of the pathology, tuberculosis is an infection of lung tissue by the Mycobacterium tuberculosis. It is transmitted by droplets that spread through the air when an infected person coughs or sneezes. The initial infection causes inflammation of the alveoli and surrounding capillaries. Immune cells ingest the bacteria and tubercles, nodules, form around the immune cells to help stop the infection. However, if the tubercles rupture, the infection reactivates, spreading throughout the lungs. This causes the affected tissue to become caseous, which means soft, dry, and crumbly masses resembling cheese. Lung capacity is greatly reduced. Fibrosis may also occur, causing a reduction of the lung's elasticity and compliance. Lung cancer. Lung cancer is a leading cause of cancer-related death worldwide. The usual cause is smoking or long-term exposure to another carcinogen, any substance that can cause cancer. Carcinogen exposure wears down airway defenses, paralyzes cilia, and creates a pathogenic environment in which epithelial cells can become cancerous. Lung cancers are classified into two main types: small cell lung cancer, which is SCLC, or non-small cell cancer, which is NSCLC. NSCLC accounts for about 80% of lung cancers. The three main subtypes are adenocarcinomas, the most common subtype and usually form in the outer region of the lung; squamous cell carcinomas, usually found toward the inferior of the lungs near the main airways; and large cell carcinomas can occur anywhere in the lungs. Kidney stones is the next common pathology that we will consider. The physiology of the kidney. The kidneys filter the blood and produce urine. Urine creation occurs within the nephrons, the functional unit of the kidneys, in 3 steps: filtration, reabsorption, and secretion. The finished urine drains into the renal calyces at the tips of the renal pyramids, then into the renal pelvis and out through the ureter. In terms of the pathology, kidney stones are undissolved mineral or acid salts in urine that have crystallized, forming stones. Kidney stones can form anywhere in the urinary tract, but typically originate in the renal calyces or pelvis. Stones larger than 5 milligrams significantly obstruct urine flow and can lead to infection or a buildup of fluid pressure. If the stones are not broken up or surgically removed, infection or pressure can cause hydronephrosis, which is swelling, damage to the functional tissue, and eventually post-renal failure. Kidney stones can also cause excruciating back pain and side pain. About 1 in 10 people will experience a kidney stone in their life. Okay, so now let's talk about gastroesophageal reflux disease, also referred to as GERD. The physiology of the normal stomach. Swallowed food, referred to as a bolus, is pushed down the esophagus by peristalsis, which is an involuntary muscle contraction that comes in waves every 8 seconds or so. The bolus enters the stomach through the cardiac sphincter, a muscle at the end of the esophagus. Within the stomach, gastric juice and the contractions of the smooth muscle in the stomach wall turn the bolus into a liquid called chyme. Chyme passes from the stomach through the pyloric sphincter, which functions like a one-way valve that directs food and waste through the digestive tract and into the small intestine. In terms of the pathology, GERD happens when the cardiac sphincter does not close properly. This allows stomach contents to leak back into the esophagus and irritates it. One of the symptoms of GERD is heartburn, the feeling of burning in the chest or throat. Around 2 in 10 people in America are affected by GERD. The next common pathology we will consider is liver cirrhosis. The physiology of the liver. The liver, an accessory organ of the digestive system, is the largest gland in the body, serving multiple exocrine and endocrine functions. Endocrine functions of the liver include the metabolism of carbohydrates, proteins, and fats. Exocrine functions include the secretion of bile into the small intestine. In terms of the pathology, ongoing exposure to high levels of alcohol or other absorbed toxins from the GI tract can damage liver tissue irreparably, causing a condition known as cirrhosis, the scarring of the liver. About 1 in 400 adults in the United States have cirrhosis. The decline of the liver's ability to regulate and detoxify the blood can lead to serious complications in every body system. Gallstones is the next common pathology that we will consider. The physiology of the gallbladder. The gallbladder stores and concentrates bile after it is secreted by the liver. Bile facilitates the digestion of fats and the removal of excess cholesterol from the blood. When the sphincter of Oddi around the opening of the duodenal papilla is closed, bile flows back up to the gallbladder for storage. In terms of the pathology, gallstones form when substances in the bile harden. These stones may stay in the gallbladder and can block the flow of bile. The stones can get stuck in the different ducts. A stone in the cystic duct can block gallbladder excretion. A stone in the bile duct can block the flow from both the liver and the gallbladder, and a stone in the duodenal papilla can block the bile and pancreatic enzymes from entering the duodenum. Around 1 in 10 Americans are affected by gallstones. Now let's consider osteoporosis, the physiology of bone tissue. Bones are remodeled in response to physical activity and mechanical stressors. Cells called osteoclasts reabsorb old or unhealthy bone tissue. Cells called osteoblasts deposit new osteoid, the bone matrix that forms prior to the maturation of the bone tissue. Mature bones include a periosteum, which is the outer tissue layer, which houses blood vessels and layers of compact and spongy bone. Compact bone is made up of rings of calcified tissue arranged in structures called osteons, which also include vessels, nerves, and osteocytes, the former osteoblasts that maintain bone health. Spongy bone contains larger vessels and marrow. In terms of the pathology, osteoporosis occurs when bone tissue is lost faster than it is replaced. It is causing overall tissue loss. This leads to bone pain and weakened and brittle bones that are more likely to break. Anyone can develop osteoporosis, but it is most common in older women. As many as half of all women and a quarter of men older than 50 will break a bone due to osteoporosis. Now, the next common pathology that we will consider is sciatica. And many of us as manual therapists will more than likely come into contact, either someone we know or someone will seek treatment from us as manual therapists because of sciatica. The physiology of the lumbar region. The lumbar region of the vertebral column includes L1 through to L5 vertebrae and the intervertebral discs between. Vertebrae are weight-bearing bones consisting of an anterior body and a posterior arch. The sciatic nerve is one of the lower branches of the lumbosacral plexus, the spinal nerves that are responsible for cutaneous and muscular innervation of the lower limbs and parts of the abdomen and pelvis. In terms of the pathology, sciatica refers to pain and discomfort along the pathway of the sciatic nerve, often originating at the spinal nerves in the lower back and radiating down to the buttock and the back of the thigh. Lumbar spinal stenosis, which is the narrowing of the spinal canal in the lumbar region, can also lead to sciatica. Compression of any of the spinal nerve roots from L4 to S3 that branch to the sciatic nerve can cause this condition. Sciatica typically affects one side of the body with mild to severe pain, muscle weakness, or numbness felt anywhere along the nerve pathway. And now the final common pathology that we will consider today is carpal tunnel syndrome. Carpal tunnel syndrome is also one of the pathologies that we as manual therapists will probably end up treating at some point during our time of practicing. The physiology of the flexor digitorum superficialis. The flexor digitorum superficialis is a superficial muscle of the anterior compartment of the forearm innervated by the median nerve. Near the wrist, The muscle ends in 4 tendons that pass through the carpal tunnel under the transverse carpal ligament. The tendons insert onto the middle phalanges of digits 2 through to 5, and the muscles act to flex those digits and the wrist. In terms of the pathology, carpal tunnel syndrome may occur when inflamed tendons or another impingement compress the median nerve. It often results from a combination of factors. For example, wrist fracture, arthritis, or repetitive motion can irritate and inflame the tendons of the flexor muscles around the median nerve. Some possible symptoms of carpal tunnel include numbness, pain, and/or weakness in the regions of the hand and fingers served by the median nerve and its branches. The nerve compression can also cause electric shock, burning, or other sensations. Okay, so we have reached the end of today's lecture, and for assignment number 23, I'd like for you to first make a 2-column chart of the common pathologies discussed in today's lecture with the name of the pathology in one column and the description of the disease and symptoms in the other column. And then I'd like for you to, of the common pathologies discussed in this lecture, state which conditions manual therapists are likely to treat. And I should say likely to treat directly because of their disease. So if you have any difficulty with this assignment, please send me an email or shoot me a text message. This assignment is due this coming Sunday by 11:55 p.m. Remember that my office hours are on Thursdays from 4 to 6 p.m. And with that, I look forward to receiving your assignments, and I will see you in the next and final lecture, which is lecture number 24 for this course.